Back injuries could be some of the most debilitating, but you don't need to live in pain. Dr. Llewellyn Pakia Raj works in physical medicine and rehabilitation at Overlake Medical Center and Clinics, and he joins us now to tell us all about it. Hello, hello.
Hey, it's great to be here. Thanks for having me.
Thanks for being here. So, what types of injuries and conditions does the Sports and Spine program treat?
Yeah, so we pretty much treat the gamut of injuries from a simple strain or sprain all the way up to complex back problems. So you have pain, come see us and we'll help you take care of it.
Oh, I like that. Okay. How does your team approach care for patients with spine-related concerns in particular?
We have what we call a comprehensive approach. We take a good history and try to see what's going on, how the pain has affected you in your life, in the context of who you are, what you want to do with your life, and how it's affected you. And we have a whole team of specialists, from just our physicians to physical therapists, massage therapists, and a whole spine surgery team that we integrate, and we send you to the right person. And if you can't find the right person, we help you find it.
That's amazing. So really the first time that I'm visiting you in consultation is to really personalize it and figure out what's wrong, and then the approach from there.
Exactly. We asked you basically, what is it you want to get back to doing that you're not doing now? And we help you get back to it.
Amazing. What makes Overlake Sports and Spine program unique compared to other places and clinics?
It's a great question. I think I'd have to boil it down to passion. As medical director, I try to foster a sense of teamwork and building your dream job. So my team, when we come to work, we love what we do. And that kind of shows in how we treat everybody. When you love what you're doing, people can feel it. And you put that passion into what you're doing. So when we see a patient, you're not just a number, you're not just an insurance thing, you're someone who's really here, who's suffering. And we want to bring our love of what we do and our passion for what we do into your life and make you feel better and get you back to feeling passionate about your life.
That's such a great answer. How long have you been in this profession? Because I can feel your passion and it's exciting.
I've been practicing for about 24 years now.
Wow.
Yeah.
Amazing. And beyond injury treatment too, what services do you offer to help people return to their normal activities? I know we touched on this earlier, but if you wouldn't mind again.
It's a great question. Well, injury treatment is kind of a multifaceted thing. We identify the actual injury itself, then we identify how much is it affecting you. Some people come to us in chronic pain and they're so afraid of moving, they're so afraid of doing things. We actually hook them up with mental health counselors. We'll use other things like acupuncture, hypnotherapy, chiropractic, and other modalities that can help people get back to work. So again, we use a full spectrum of treatment options and kind of tailor it to what would best fit you.
I wouldn't always think about the mental aspect, but that makes perfect sense when you're just terrified to even move when you're in chronic pain. It can sometimes take a while before someone actually decides to see a doctor for whatever reason. At what point, though, do you think that they should really seek out care?
Yeah, there's a couple times when you really should seek out care. First is when you're having weakness or neurological symptoms where you're suddenly your leg or your arm isn't working right. Definitely see a doctor. Other times is when you're suddenly finding your world shrinking. There are things that you used to do that you're not doing anymore, that you find yourself not looking forward to life, that you find yourself, your pain is keeping you from doing things that you want to do. That's when you definitely should see a doctor.
What would you say to people then that are nervous to come in and are dealing with pain? What's your advice?
Don't be afraid. Pain is sometimes just pain, but sometimes it's a harbinger of something worse. And it's better to face it and better to deal with it than to put it off.
Definitely. Describe your team too, because it's such a full team approach that really sets you apart.
Yeah. From the first time you pick up the phone and someone talks to you with our front end, all the way through scheduling, through our medical assistants who room you, through our clinicians who see you, through our therapists who deal with and treat your therapy, to our insurance specialists, we all have that philosophy of this is what we love to do. And then we work out with teams out in the community. So if you don't live close to us, we'll talk to your physical therapists who live close to you. If we want to speak with surgeons who are not close to where we work, well, we know them and we work with them for many years. So we will tailor your team to what you need, where you are, and then make it the best thing that we can do for you.
Great. Okay, if someone wants to learn more or schedule an appointment, where's the information? Where can they find you?
On the web, we're at www.overlakehospital.org/sports and spine, or you can give us a phone call at 425-394-1200.
Amazing. Any last tip before we leave today?
if you're not living your best life and you don't know what to do, come see us. We'll help you.
I like that. Thank you so much, Doctor, for being here. I know you're very busy. We really appreciate your time. And here's that website again to find out more about sports and spine care and to, of course, book an appointment.
New Day Northwest is sponsored by Overlake Medical Center and Clinics.